Proximal hamstring tendinopathy, or high hamstring tendinopathy, is one of those conditions that is really tricky to treat and can take a very long time to recover. The problem is also that there's no one-size-fits-all treatment plan. What we find often is that what works really well for one person just makes the next person worse. My aim with this video is to help you understand your treatment options. And we're going to start by looking at what the aim of the goal is of the most successful treatment plans out there. Then also look at all the treatment options you have to achieve those goals. And of course, I will base it on the latest research, but I'm also going to use our clinical experience because not everything's been researched, and we see this condition quite often in our online clinic. And then I will also highlight the treatments that will likely make it worse or the ones that really just never seem to work. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for any type of sports injury, all done via video call. Now, I realize this sounds weird because the most common question we get is, shouldn't you be touching me to assess me or to give me a treatment plan? But the thing is, with most types of sports injuries, especially tendon injuries, the diagnosis is mainly made by really listening to the patient and understanding what affects their symptoms, as well as getting them to do some movement tests to see how that affects the tendon. And we can all do all of that by video call because we can see you move. And same thing with the treatment. It's really about getting the load management right and the rehab plan right to help it calm down and recover. Now, of course, if we feel something else is needed, we do refer people on. If you want to know more about the service, have a look at the description of this video. I'll put a link there. You can get really technical about what actually happens in the hamstring tendons when they're injured. But there are three things you really need to understand the aims with the treatment and what treatments will work best. The first is that you injure your hamstring tendons through overwork. Now, this overwork can either be through an activity, so maybe a sport like running, but even something like you did a lot of gardening, bending over. It can also be through sitting or overstretching because there's a lot of compression between the tendon and your sit bones in those positions. I've discussed the causes in detail in a previous video, so have a look at the description. I'll put a link there. So overwork causes it. Now, once it's injured, the tendon becomes really irritated. So it becomes painful and it loses its capacity to cope with the normal loads you put through it. What does that mean? It basically means it loses a bit of strength and endurance. So now when you try to do your normal things, it just irritates it further and really makes it hurt. The other thing to understand and keep in mind, and I've explained it in that other video I've mentioned, is that the pain isn't directly linked to how weak or how much capacity it's lost. The pain and the sensitivity is kind of a beast on its own. It can be super, super sensitive, but actually quite strong. Or it can lack quite a lot of strength and not be that painful. So we need to look at both these elements when we think of the treatment plan and address them both at the same time. Now, as I mentioned before, there are many ways that we can address the irritability as well as the capacity or the strength. But the main aim with the treatment plans is reduce the irritability so the pain calms down, help strengthen the tendon and get it used to the normal activities again. And then eventually, third step is to bulletproof that tendon so it doesn't get injured again. Now, these things do not happen like, oh, the pain's got to calm down first, then I can start strengthening, then I can bulletproof it. It's all kind of happening together because if you just wait and you don't do anything waiting for the pain to go, the pain's not going to go because the capacity is not increasing. So you don't have to wait until all your pain is gone. We just have to manage it at a specific level, and I will explain that as well. The top three treatments that works the best for high hamstring tendinopathy, and I will get into them in detail in a minute, is relative rest, where you reduce your activities to allow the tendon to calm down. Careful progressive reloading, where you slowly build that capacity up as your tendon pain calms down. And then third, looking at different elements in the pain system that can hypersensitize the pain system and make it more irritable than what it should be. And all three of these things happen at the same time. So let's first look at relative rest, because this is the first one you've got to get right. It doesn't help that you strengthen up your tendon as much as you want, and then it just remains painful. And then you've got a strong tendon, but your pain is still bad. So what does relative rest mean? It means that you don't have to cut out all your activities. What we do in our online practice is we look at a patient's history and we look at what activities is currently really pushing the pain above what we want. Now, what we're looking for pain-wise with this, according to the research, is that it doesn't matter if you have a bit of discomfort when you exercise or do activities. In fact, you can't expect to be pain-free at the start when you do things. But as long as we don't push it above a certain level, the pain system will calm down. If you push your activities constantly into a level that makes it a lot more sensitive later in the day or the next day, then you keep the pain cycle going and the pain's not going to calm down. Your tendon may get stronger and actually the injury may look as if it's healed on a scan, but you're going to be left with pain. So if you are stuck in a pain cycle where your tendon actually doesn't look that bad, but you've got a lot of pain, it may be the pain system and your load management that needs addressing. What we find works best and is supported by the research for this is you try and avoid complete rest if you can. So you only look at, okay, what activities really pushes into too much pain? How can we adapt that? Anything that you can do without really increasing your symptoms dramatically, you continue doing because there's no reason to stop doing them. Now, what you're looking for is when you do an activity, we want to always try and keep that pain down to a niggle level. And with a niggle level, it's always difficult to say out of 10 because some people have a really high pain tolerance, others really low. So in the research, they talk about a 3 out of 10 pain is okay because that doesn't push your pain system too high that it becomes more irritated. But if you push your pain system into a lot of discomfort every time you do things and your pain stays really high for 24 hours or even longer, then you just hypersensitize the pain system. You're not necessarily making your injury worse, but you're making it more sensitive. And then you can end up in a situation where actually your tendon is nice and strong and looks okay on a scan, but you have severe pain. And then everybody goes, well, now we don't know what's going on. But it's because you're not allowing the pain system to calm down. So this step is really important to understand and apply in your day-to-day rehab through everything you do, is you're looking for no more than a niggle or 3 out of 10 discomfort while you're doing an activity. And then also, it shouldn't increase your discomfort 24 hours later or in those 24 hours later by more than about a 3 out of 10 discomfort above what you normally get. So we really want the discomfort to just do this throughout the day and over several days and throughout the week, rather than go boom, up, down, boom, up, staying high for several days and then calm down. And then you do exercises again and it goes up and it stays really high for very long. If that's what's happening, you need to look at what you're doing, how you're doing it, the total load in the day that you're putting through it, that you can start getting that tendon to not overreact in such a way. In summary so far, it's absolutely fine to start with exercises while you still have some discomfort, as long as it doesn't push that pain too high. It's absolutely fine to continue with any activity that doesn't cause an increase in your symptoms, a significant one like I've just explained. And if there are activities that does that, it's important to not just stop them immediately, but rather look at how can you adapt them, because it's always better to adapt activities that you can still do some of it, because that helps sustain the tendon's tolerance to that activity, and then you can build from there. So if we think of common examples, sitting is one that people really struggle with. And I've made a whole video about sitting and ways that you can adapt your sitting position and things to help actually with your rehab, and how to use sitting as part of your rehab. But as an example, with load management, instead of sitting until you really can't tolerate it anymore, you sit until you feel, okay, it's becoming a bit, it's getting to where it's feeling more than a niggle, and then you change position and you do something in a different position, and then you come back to sitting later on in that day. So you're not just standing all day long, because then the tendon doesn't get used to it either. So it's that balance. For running, for instance, it may be that for a period of time you need to not do such long runs, or run a bit slower. Perhaps just play with the terrain you're on, that you avoid hilly terrain, because that would make it worse. So there are many ways that you can adapt activities, and that is one of the things that our team is really good at helping you with via video call. The second treatment in the most important treatment bucket is progressive loading. Now, whenever I say that, people immediately think, strength training exercises. But it's actually about more than that, and I'll explain in a minute. But why is progressive loading needed? If we think of the tendon, it's made up of lots and lots of collagen fibers that's packed into parallel. And collagen is that white sinewy stuff in meat that's really strong. So tendons are really strong things. But when it's injured, part of that tendon doesn't look as pristine. The collagen fibers in that area is injured and they're not as strong as they used to be. And that's why it doesn't want to tolerate all the activities you want to do, because it's just lost a bit of strength. Now, you can create new and stronger tendon fibers as well, collagen fibers as well, through exercise and through loading at and using the tendon. Same as you do with muscles. How if you use your muscles, they grow bigger and stronger. If you lie on the couch for 2 weeks, you lose muscle strength. Same thing happens with your tendons. So how can you do progressive loading? Well, there's 3 elements to this. One is, obviously, yes, you can use exercises that focus specifically on contracting the hamstring muscles, because when they contract, they pull on the tendons, and that stimulates the tendons to get stronger. And you can use a variety of exercises for that, including bridges, hamstring curls. In the later stages, you can use deadlifts and squats even. I will make a whole video about the rehab for this, because it's not something I can talk about very quickly in a video, and there's a lot of ifs and buts. There's already one video I made for people who are struggling with bridges that they hurt, with tips about how you can adapt the bridge. Have a look at the description if you want that video. The second thing you can do to rebuild that tendon and get it stronger and used to normal things is sitting. Because the hamstring tendon, yes, it has to cope with pulling forces as you contract your hamstrings, but it also has to deal with compression forces. And we include that compression element in some of the exercises as well. But sitting is one of the main things we do during the day that compresses the tendon. Now, not everybody's hamstring tendon will be uncomfortable when they sit, but quite a lot of people find that sitting is one of the most aggravating things for them. And you can use that carefully to build up your sitting tolerance and your tendon strength for compression again. I've mentioned before, I've made a whole video about how you do that. Have a look at the description for details on that. Third element is actually just using your normal daily activities and increasing them so that you restore the strength in the tendon. Now, ideally, you use all 3 these loading elements in your plan, but some people find that doesn't matter what exercises they do, it just always aggravates them, even if it's the simplest and the lightest. And for them, I find leaving the exercises until much, much later, or not even doing them sometimes at all, is the better option. And you just use actual movements and activities like walking, hill walking, stair climbing, running even, to actually rebuild that strength. Now, you can't do it for all cases. It's only for specific cases. And it's really about how you test what works and what doesn't work with your physio to eventually get to the perfect plan with this. The biggest mistake we see patients make when they're trying to reload the tendon or use exercises and things is that they use exercises that start in the wrong positions, that just irritates the tendon, or they start ramping things up too quickly. They nail these exercises and then suddenly they want to do them with heavy weights, or they want to do too many of them, or they've gone back to running and just ramp their running up like they would do if they were just training for fitness. And actually, that tendon tissue takes a long time to create new fibers and to get stronger. So you need to keep that in mind when you do your loading. And also, we've got the pain system sitting here. If you ramp up activities too quickly, it kicks off the pain system, even if the tendon is happy with it, and it increases the pain with that. So it's always about balancing those 2 elements. And then one of the reasons why often people will find that it flares up when they go back to normal activities is if they've simply not actually built their exercises up to the level they need for the things they want to be doing. How can you know what exercises or activities are right for you? Well, a big clue is already in your history. So that's part of the first session we do, is we always talk a lot with our patients to really understand their history, how their symptoms react to different things, because that gives us a good idea of what we can likely start with and the volume of stuff we can start with, but also how the activity started and what they want to be able to do eventually, because that tells us about where the end point of their rehab plan should be what level we need to build up to, and also what we need to watch out for, that we really bulletproof them against that. Because, I mean, it's obvious that somebody who wants to go running will have a different rehab plan from somebody who just wants to walk or just wants to sit and doesn't have any, they don't really want to be running or jumping. So that is quite an important thing as well that you've got to keep in mind. And then finally, you can also figure out what is the most likely, the best exercises to start with by doing some simple movement tests and just start testing from the easiest versions of exercises and see how the tendon reacts. So often what we find with our patients that works best is we start them off with the simplest of plan that we can see will work for them. We ask them to give us feedback about the 24-hour pain response, because the problem is that stupid tendon often doesn't tell us in the moment that it's going to flare up later. So we have to understand the 24-hour pain response first, and then we progress exercises from there, so that eventually you get to a plan that your tendon has settled into and that we can see works really well for it. So it's not on day one you can get a perfect plan. You've got to experiment a bit and check that pain response and adapt the exercises to that. The third element that has to be included in all treatment plans, and that the research also supports as being really, really important, is addressing factors that could be sensitizing the pain system. I have spoken about the pain system in a lot more detail in previous videos, and I will link to that in the description here so you can get a good understanding of how the pain system works. But in summary, your pain system is your body's alarm system. And we used to think that if you've got a bad injury, pain is high. If you have a not that bad injury, the pain is low. And as you recover, pain comes down. But now the research has shown that actually that's not the case. You can have people with really bad injuries, nearly no pain, and then people with no injury anymore. It's totally healed, but the pain persists. So the reason that goes on is that actually the actual pain is created as an alarm by your subconscious brain. And I'm not saying that you're imagining the pain. The pain is real. It's just that the subconscious has to decide how much pain to create because it wants you to take a certain action. Now, if there's things that makes the subconscious think that this injury is more dangerous or can impact your life more than what it should, it's going to dial up the pain system. If you keep on irritating it and pushing really hard, it's going to start feeling, I need to get you to take things calmer. It's going to dial up your pain system. So things that's been shown through the research that can dial up the pain system and make it more sensitive than what it should be is stress. So we're thinking work stress, family stress, anything that can bring your stress hormones elevated for a long period actually sensitizes the pain system as well. Also, if you have had pain for more than 3 months, that actually gives you more pain receptors and make them fire off more quickly and give you a bigger response to whatever you do long before you're causing tissue damage. And that can sensitize it, which is quite annoying because most people with high hamstring tendinopathy does have it for more than 3 months. So there's always an element of the pain system being sensitized. Then there are things like emotions, being angry, being fearful, worrying a lot about, are you going to lose your job, things like that. But like I said, I've gone into detail about the pain system in a different video, so I'm not going to explain it further here. But the most practical things that you can do to get the pain system to calm down is look at those things, but then also the load management and respecting your pain when you do your exercises and other activities. Because the more that you don't send the pain system into high alert, the more it starts to trust the system again and what you're doing, and it calms down. So that's why it's so important not to exercise into too much discomfort or pain, but just keep it at that niggle level, because then it actually helps it to calm down. So let's look at the other treatments you can add on top of the 3 I've just spoken about to also help. The first is red light therapy. Now, the research into tendons and red light therapy shows that yes, it can help reduce tendon pain. There's not any evidence at the moment that it actually changes the tendon structure or helps the tendon heal itself. So you have to still do the things that, like the rehab and the load management, to get the tendon to actually recover, but it could help decrease your pain. It does depend on what type of device you use, and there's specific settings that you should be using for it to make it effective. And I've talked about all of this in detail in a different video, so have a look. I'll put a link in the description of this video to that one. Then we've got supplements. Now, supplements are not that well researched yet, but there is evidence that if you combine vitamin C with hydrolyzed collagen and time it well around your rehab, that it can actually lead to better results from your rehab. Again, it's not a golden fix, but as an adjunct to the rest, it may be useful. I have talked in detail again about the specific dosages and what is best, the best type of supplements to use for that. And we've looked at different types and how effective it might be. So have a look at the description of this video. I'll put a link to that one there as well. Number 3 on the list is nitroglycerin patches. Now, these patches are meant to help with pain. And some of the research studies shows that, yep, they do help, but others show that they're not really that effective. The important thing is that in all studies, they didn't really have any bad side effects. So this could be something to try if nothing else is really working and your pain levels are really high, to just get you to a point where you actually can start proper rehab. I don't think you can get this over the counter. You usually need a doctor's prescription, so it's something to speak to your doctor about. Then we have PRP injections, or platelet-rich plasma injections, and these are meant to stimulate the tendon to regrow and get the growth going again. Now, they are very commonly prescribed for high hamstring or proximal hamstring tendinopathies, but actually there's very little research evidence that it works. In practice, what we find is that for some people it works really well and it's the thing they need to get over the hump and be able to recover. And then for others, we find it has no effect and there doesn't seem to be much rhyme or reason in it. So with PRP, it's not something I would use as a first line of defense. If your tendon has become painful only a few weeks ago, I would likely try load management and reloading and all the things I've spoken about first. If you've got an ongoing case that just doesn't want to react and you're struggling to get going with your rehab, PRP injections is something I would consider, but I would look for somebody who can do it under ultrasound guidance so that you know where it's going, and it may not always work. So just keep that in mind. A treatment we're often asked about is massage. And yes, massage is absolutely fine as long as you're mindful of the high hamstring tendons. So if we think of really irritated tendons, if you go and you really press hard over it and squash it against the sit bone even further, you usually just irritate it more and that makes the pain flare up. So what you want to do is you want to focus on the muscles instead. And if you release the muscle tension, you can really get some of the extra pain and discomfort to calm down as well. So massage for high hamstring tendinopathy should always feel comfortably uncomfortable. If it feels painful while somebody is doing it and you having to breathe just to tolerate it, that's likely just going to irritate the pain system and make it feel worse. So if you're going for a massage and you have a quite easy irritable tendon, tell the person to just take it easy over the tendon. They may tell you something like, oh, I'm stimulating the healing process. Well, there's no evidence that that happens, that can actually stimulate that. And there's a lot of what I've seen in practice is if you're too tough on a tendon that's irritated, it actually makes it flare up. Yes, of course, there's cases that's not that sensitive, that's just a bit uncomfortable, and hard massage can be useful for that. And it can get the pain system to calm down. So it's just about picking the right type of massage for the right type of person. But you don't have to go to a therapist either. You can do it yourself. You can just do massage on the hamstring muscles using a foam roller or even a massage gun. That can work well as well. Dry needling is another technique that people use, and that's where you use the same needles as with acupuncture, but again, you put it into the muscles to help that relax. And there is evidence that it can reduce the pain you feel with a tendinopathy. Shockwave is another popular one that lots of clinicians use for high hamstring tendinopathy. Now, the research on that is also inconclusive, that sometimes it works, sometimes it doesn't work, and that's what we see in practice. What I will say is that if it's more of a chronic case, it seems to work better. So some tendon that's been flared up for several months. What I found in practice is if you use it on a case that's too recent, it can sometimes actually make the pain feel worse, or it just doesn't work. Also, if it hasn't produced results within 6 sessions, it's likely not going to work. So don't let somebody make you pay for 12 sessions or even more. I sometimes get people tell me that they've been doing without any results. If you're not seeing any results after 6 sessions, it's likely not going to work. Ice is a brilliant one to calm pain down. Now, you can overuse it and then it's counterproductive. So it's important to use it in a responsible way. So you only want to use it really for 10 minutes at a time, take it off, put it back on for 10 minutes at a time. And if you're worried about using ice, I've made a whole video about high hamstring tendinopathy and the use of ice and how to get best results and when maybe not to use it. So have a look at the description of this video. I'll put a link there. Heat is also an option, but you only want to use heat in cases that's older than a couple of weeks, because right at the initial start, when your tendon flares up, there may be a bit of inflammation involved, and you can actually make it feel a bit more painful and worse if you then heat it up dramatically. But if it's older than a couple of weeks, heat is absolutely fine to use. But again, you can overuse heat. So you don't want super, super hot that you can actually damage tissue or burn yourself. And you also don't want to heat it dramatically all day long. You want to use it when you feel, okay, I'm really uncomfortable, I just need a bit of a break. If you're finding that you have to sit on a heat pad the whole day long, then you likely actually need to look at what you're doing with your sitting and how you need to break that up better, that you don't need the heat pad for all of that. So have a look at the description for that sitting video. A TENS machine can also be useful. So TENS is where you have one of those machines that you put the electrodes on the skin and you cover the area where your pain is. And then it just gives an electrical signal. It's not the one that contracts the muscles. That's a different one. But those machines often have a TENS setting as well. The TENS only really works for pain while you're using the machine or for a few hours afterwards. So it's not a very long-lasting effect. But if pain is one of your most important factors in your specific case that really makes your life miserable, then a TENS machine is something to consider trying. They're not too expensive on Amazon, and it's an easy thing to try without any real side effects. Now we're getting to treatments that's really only needed in specific cases. And the first of that is losing weight. Now, please, if you're carrying 1 or 2 extra pounds, this is not for you. We're talking about people who are heavily overweight or being classed as obese or significantly overweight. And the reason this is important is because fat tissue, especially the fat tissue around the belly, has been shown to secrete hormones and change the blood chemistry that makes it more difficult for tendons to heal and can just make things go slower. So if you are significantly overweight, then losing some weight can help. If you're not overweight and you're going to cause yourself to be underweight, then you can actually also stop the healing process because your body's just not going to have the elements they need to heal. So don't go losing weight just because you think, oh, that'll help. It only works if you have a significant amount of fat that may be causing chronic inflammation. Hormone replacement therapy is also something to consider if you're in any stage of the menopause. And this is because estrogen levels drop during the menopause or the perimenopause, and that directly affects your collagen turnover. So the body becomes more difficult to produce new collagen fibers and make them stronger. And there is evidence that the drop in estrogen levels is implicated in both causing tendinopathy as well as delaying recovery. So if you find yourself in any stage of the menopause and you're not on HRT already, speak to your doctor because it may be an option for you to just help your recovery process. We have made other videos about the menopause and sports injuries, so have a look at the description of this video if you want more information on that. Anti-inflammatory medication is something that people are often prescribed for high hamstring pain, or that they just try themselves because they want to calm the pain down. But it doesn't actually usually work for cases that's caused by overload. So if it's a pure tendinopathy caused by overtraining, then it doesn't really calm the pain down because there's not a lot of inflammation in the tendon after the first 2 weeks. You also don't want to use it routinely in those cases because it may dull the healing process a little bit. But don't worry, if you use 1 or 2, it's not going to be detrimental. It's more if people really, really use it for weeks and weeks on end. There are cases where it's really important to use the anti-inflammatory medication and where it's the correct treatment and where your tendon really needs it. And those cases are where you have bursitis as well, so inflamed bursa, or you have tendinopathy right at the attachment called an enthesopathy. Also, if you have inflammatory tendinopathy or tendinitis, so linked to an inflammatory condition like gout or psoriasis or any type of inflammatory arthritis, then you also likely need anti-inflammatory type medication. Sometimes it's a different type of medication to calm that inflammatory response down before you can start with any rehab. And sometimes you don't even need rehab if you address the inflammatory component then. So it's really important to speak to your doctor and get the inflammation treated if you have an inflammatory condition. But like I said, most cases of, if it's a sports injury caused by overload or by overload through sitting, it usually doesn't have an inflammatory component, and then anti-inflammatories doesn't actually work. Now, if your pain persists and you've done everything that you're supposed to be doing and your levels really remain high, high volume injections is something that could help reduce your pain. Now, with a high volume injection, they combine a lot of fluid, so that's the high volume of fluid, and it's just clean water, saline, with a small amount of anesthetic, so that's a pain dulling substance, and also a little bit of corticosteroid. Now, I know in previous videos and later in this video, I'm going to talk about corticosteroid not being good for tendon health, but if your tendon pain has been going on for so long and it's not calming down and nothing you do helps, then these injections do seem to work, and they do seem to be actually safe. And I think it's because you don't use that much corticosteroid here. You just use a little bit, and you've got that element of the anesthetic that calms the pain system down. And they think that the high volume that they're injecting, the fluid they're injecting, is stimulating the tissue and irritating it so it can actually start the healing process. So these injections do seem to help with pain, and they don't seem to have any negative side effects, but they're not for everybody. Then we get to corticosteroid injections. Now, they are quite controversial because what the research is showing is that corticosteroid injections work really well for short-term and medium-term pain relief. But then when you look at long-term recovery, they may actually affect you that you don't recover as well or as quickly long-term, because it can affect how well the tendon can produce collagen fibers. However, some cases of high hamstring tendinopathy can be really, really stubborn and just not react to anything else. And in those cases, corticosteroid injections can be really useful. So I don't want you to avoid it at all costs, but you do need to understand that you should try everything else first and see how that works. But if you're stuck, then this is something that could be considered before you think of surgery. Okay, so you've tried all the treatments, but it's just not working and your tendon's remaining painful. Then surgery may be an option because some cases do need surgery. However, the research suggests that you should have tried at least 12 months of the correct rehab and load management before you opt for surgery, because this condition takes a very long time to recover. It's not something, especially if it's been going on for several months, it's not something that's going to get better within a few weeks of doing your exercises. It can take 12 months, sometimes 18 months or longer to fully recover. And surgery isn't a given that it will help. It helps in some cases, but not in others. Luckily these days, there are very little invasive techniques that they can use. Is that the right word order? Not sure, but it means that they don't have to go and do open surgery necessarily. You've got techniques like 10X or 10Jet, where they only make small holes and they use really high frequency ultrasound or water jet to cut away the injured part of the tendon. So they're not repairing the tendon, they're taking away the injured part, but that can often solve the problem with the pain, and you can then strengthen the rest of the tendon up to be able to cope with what you want to be doing. Open surgery is advised in some cases, especially sometimes if you've got chronic irritation of the hamstring tendon. It can cause the nerve that runs really close to it to also attach to the tendon, and then it can't slide that freely. And in those cases, they may have to go in and also just free up the nerve. And there are other types of surgery that they sometimes do where they just cut the injured part of the tendon, that it's free from the bone, and then the pain stops and the person can strengthen the rest up, that they can get strong and get going again. So there are loads of different options for different types of surgeries you can have. And I am not an expert on what works the best for what case. I would just say that I would start with the least invasive first and see how that works, and opt later for the ones that's more like open surgery, because they can cause more scar tissue that can then cause trouble. But your doctor or surgeon who does these type of surgeries are the best person to talk about this, because they can tell you exactly what you can expect from the outcome and for what cases what works the best. What treatments do you want to avoid? What will likely make it worse? Well, we've spoken about a few of these, but the first is that you don't want to just rest your tendon and avoid everything that makes it feel a little bit uncomfortable, because it will never then get used to your normal activities, and you can actually increase and hypersensitize your pain system if you start avoiding everything in life that you want to be doing, like never sitting, for instance. So the better option is relative rest and a short period of rest, and then easing back into things. Also, we've spoken about the hard massage over the tendon. Cross-friction type massage should only be done in cases that is not very irritable and that has been ongoing for a very, very long time. In most other cases, it usually makes the pain worse. Then a treatment that should not be prescribed for tendon injuries is taking corticosteroid tablets. Now, it's absolutely fine if you have to take it for a lung condition like asthma, for instance, or for any other medical condition, but it shouldn't be prescribed purely for your tendon injury. Bizarrely, I find people often have that prescribed for them because it's so good at calming the pain down, but it works on the whole system and it actually affects your body's ability to produce new collagen. So you don't want that going around the system unless you need it for a different medical condition, because the medical conditions that need it usually are quite serious and they really need the corticosteroid. So don't stop it if you're on it for a medical reason. Speak to your doctor about it, but continue with it, because that medical condition usually trumps the tendon injury. But if you've been purely prescribed it for your tendon, you need to talk to your doctor about how to get off it, because you can't just stop corticosteroid tablets like that. Your body needs to come off it slowly because it needs to get used to producing its own cortisone again. So you've got to bring it down slowly. So don't just go cold turkey if you've been using it, please. Then lastly, it's hamstring stretches. And it blows my mind how often people still prescribe hamstring stretches as a treatment for high hamstring tendinopathy. And the problem with the stretch is that it wraps your hamstring tendon that's injured really tightly over your sit bone and just pulls it tight over that and squashes it. Now, if you can imagine an irritated tendon, it's like really pressing on a bruise really hard, and it just makes the pain worse, especially in cases where stretching was the whole reason why the tendon pain started. So stretching the hamstring tendon is not something I advise people do within the first few months of high hamstring tendinopathy recovery. In fact, we usually only ease people into that much, much later when their tendons have pretty much nearly fully recovered, because it can be quite tricky. And you have to introduce stretching very gradually throughout the plan. So you can't go from avoiding it always and then suddenly being able to stretch. You have to build it into the rehab. And we find it works best if you start building it into the strength training. So you'll get the tendon able to tolerate the exercises that doesn't really stretch it, like just floor bridges and hamstring curls, and then slowly ease into exercises where you work the tendon more into a stretch position, but not full range, like a deadlift, for instance. But you won't go full into the deadlift initially. You just start light weights, gentle movement into certain parts. I'll talk about that in detail in a rehab video later. But that's what we tend to find works best for our patients online as well, is if we avoid hamstring stretching at the start and then slowly build it into their rehab as their hamstring starts to tolerate it. And passive hamstring stretches comes right at the end of it, if they even need them at that point. You can use massage, like I spoke about earlier, to help your hamstrings if they're feeling really tight and stiff and uncomfortable. Now, something that's not bad for you, but it's also not that useful, is therapeutic ultrasound. So often therapists in clinic will put ultrasound on you. It's not the one that shows you images. It's just the one that they use for treatment. It can be useful for some things, but not really for tendinopathy. The research doesn't support it. So that's not something that's useful to add onto treatment here. Another treatment that we're often asked about are peptides, specifically BPC 157 peptides. And it seems to be that it's being recommended all over the internet as being an effective treatment for several types of injuries and can promote healing. But there is no research to actually support the use in humans. It's not been researched to the point that we know it's safe or that it actually helps. So I would advise you to not use it because it's unknown and it may actually cause side effects that we're not aware of yet. If you want more information about that, I'll put a link to an article I've written about the current state of the research on this, because I know you're hearing lots of people telling you that you can be using it, but I don't like experimenting on myself. I would rather let them do proper studies and show that it's safe and that it has benefit before I experiment with things like this. How long can you expect your recovery to take? Now, this very much depends on for how long you've had your injury for. So we find that if you take quick action, so if your pain only started a couple of weeks back and you've immediately stopped what you've been doing and been looking after it, then the quickest you can recover is within 3 months. And that's if you're lucky. In reality, it usually takes more like 6 months to 9 months to get back to full sport. But if, unfortunately, people are not always given the best advice immediately after they get injured, and then the pain can really flare up and keep going, and it can become a bit more chronic. In those cases, it can take 12 months to even 18 months to fully recover. It doesn't matter if you've had your pain for several years. We've even had patients recover to a point where they can do their activities pain-free if they've had it for several years. So it's all about getting to understand the pain system and then getting that load system right and just keeping at it. Now, if you want help with your recovery, this is something we treat often via video call and that we get quite good results for. So you're welcome to book a consultation with one of the team. The link to the website is in the description of this video. If you've got some questions, please feel free to ask them in the comments and let me know if you thought it was useful. Take care.